All right. This week we'll be going over nutrition and hypolipidemics or anti-lipidemics, either way. Drugs that lower your lipid count. So nutrition is kind of the first route we want to look at when it comes to pharmacology in general. We talked about how anything that you put in your body that's going to change the function of it, the physiological processes, is technically a drug, right? And so nutrition is our first drug to go into, right? Whatever you put in your body is going to change how it works. A lot of the stuff that we're going to talk about in this section is the things that you need to put in your body for it to work properly, okay? We have certain foods that are essential. What does it mean if a food is essential, or if a part of it, like you probably read, like it has 8 essential vitamins and minerals, right? What makes it essential? Essential are things that you have to eat. Your body does not make that vitamin or that mineral or even those amino acids. So we have some essential amino acids and fatty acids. The fatty acids are going to be your polyunsaturated, your omega-3s, your omega-6s. For your amino acids, you have isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. So what happens if you don't get enough of these essential foods? Well, then you're not going to have the stuff to build the molecules you need, right? So these amino acids, if you don't ingest them, you're not going to be able to make the proteins that require those amino acids, right? Let's go through some vitamin deficiencies. So vitamin A, this is important. We'll go a little more in detail on these in a bit, but vitamin A, if you don't eat enough vitamin A, if you don't get enough vitamin A in your diet, you can have night blindness, dry skin, decreased epithelial cell growth. Vitamin D, you get bone loss. Vitamin E, you get anemia, also increased secretions. Vitamin K, we talked about this one last time when we were talking about your blood clotting and clotting disorders, that K is really important in a lot of your clotting factors. And if you want an anticoagulant, you can interfere with vitamin K. Vitamin K is very important for coagulation. Then we get to our B vitamins. So vitamin B1, also called thiamine. Without that, you can get anorexia and constipation. Riboflavin, B2, ocular itching, and glossitis. Glossitis is a swelling of your tongue. Niacin, or B3, can give insomnia, delusions, and confusion if you don't get enough of it. Pyroxidine, vitamin B6, can give you anemia, convulsions. B12, cyanocobalamin, can cause macrocytic anemia, also muscle incoordination. And then we get to vitamin C. Without that, you can get bleeding gums, bruising, loose teeth, things that are associated with scurvy, right? And then folic acid or folate, you can get macrocystic anemia, also various neuropathies. So, why are these vitamins important? They each do a little bit of something different, right? And they act as cofactors or coenzymes with other enzymes to turn them on and activate them. And so they help with activating different enzymes or working with enzymes to help them do their job. So with vitamin A, beta-carotene is provitamin A. You find beta-carotene in your yellow vegetables, your orange vegetables like carrots, right? Vitamin A1 is called retinol. It hooks up with opsin to make rhodopsin, and rhodopsins are what rods need to see in low light. And so if your parents are like, you need to eat your carrots because they're good for your vision, well, it's not going to help your vision acuity. So you're not going to be able to like see sharper, better, or enhance colors or anything like that. But if you don't get enough carrots, you won't be able to see at night. And so technically, yeah, kind of, sort of, it does help your vision, but only night vision, right? And that's only if you don't have enough of it. It's also required for RNA synthesis, cholesterol, and protein synthesis that help to protect your epithelial cells. And so if you don't have enough of those, then you're not going to be making your RNA, cholesterol, and those proteins that protect those epithelial cells. And so you'll start shedding them. Retinoic acid might be something you've heard of before, especially if you have acne or have had acne. It's used to treat acne vulgaris. And what it does is it causes a reduction of the sebum. Sebum is the oils that come out from your sebaceous glands. And it's an acid, right? And so it eats away those old skin cells that are on your face and enhances the turnover on those epithelial cells. You can eat too much vitamin A. You want to take your daily recommended dose, not too much of it. So you don't want to be eating extra gummy vitamins in the morning, because you could get hypervitaminosis. With vitamin A, it causes headaches, vertigo, and if you keep it up, you can get desquamation, which is just like the shedding of your skin. Also lethargy, and then cirrhosis, like liver syndrome. With vitamin D, it's a provitamin that you can find in fish liver oils, egg yolks, also fortified dairy products. A lot of milks, if you look on them, they'll be like vitamin D enriched. Butters, cereals, breads. Vitamin D is also produced in the body, in your skin, and the integumentary system. When ultraviolet light comes into contact with 7-dihydrocholesterol, it can be turned into vitamin D3, which then can be into calcitriol, and then that helps your bones, right? It helps with bone reabsorption, excretion of calcium, and absorption of calcium and phosphate. So it's really important for the metabolism of bone and cartilage. It helps to increase the calcium phosphate absorption in the duodenum. The duodenum is this first little part coming off of the stomach. Again, you can get too much D, and if you do, it's going to be similar to your symptoms that you have with too much vitamin A, plus you can get bone pain and then like a metallic taste in your mouth. Vitamin E, you see vitamin E in a lot of your lotions. Also, there are vitamin E supplements that you can take. Alpha tocopherol, again, vegetable oils, eggs, cereals, milk, meat, and then your leafy vegetables. It relies on bile salts for absorption. With any of your lipophilic vitamins, you're going to need these bile salts to help bring them in through the intestine. And so when we're talking about some of our antilipidemics, some of them interfere with the bile salts, which then can interfere with vitamin E absorption. Vitamin E is a good antioxidant and helps to maintain your red blood cell membranes. Again, typically you see these in lotions, especially like diaper rash lotions. There's a lot of vitamin E in those. But they've also used it to help with cancer treatments and in preemies that have to be on oxygen therapy because it is a really good antioxidant. Then your vitamin K. Again, green veggies, cabbage, cauliflower, fish, eggs, milk. Get a lot of vitamin K. But most of it is actually produced by your body. Sort of. In your gut, by bacteria that are in your body. So you have your gut microbiota, which is really important in just maintaining a healthy body, right? These bacteria are essential. Some of them are essential because they make vitamin K for you, which is essential for blood clotting, right? Some antibiotic therapies can interfere with your vitamin K synthesis because it kills bacteria. Some of this bacteria is good bacteria, right? Also give vitamin K prophylactically to newborns from mothers who have had oral anticoagulants, anticonvulsants, or anti-antibiotics that could affect clotting. And so you give them a shot of vitamin K just to help their clotting factors. And if they don't accept that, then they can have brain bleeds, which are bad. Your vitamin B, again, lots of different types of vitamin B. Find them in yeast, whole grains, soybeans, milk, leafy green vegetables. They're all coenzymes, and they're all integral to cell reproduction and maturation. They do different stuff along the way. So like your thiamine, when you pair it up with ATP, it's critical for carbohydrate metabolism. Riboflavin with different proteins, you need it for respiration in the lungs. Niacin for oxidation reduction reactions. B6 for your metabolism of carbs, fats, and proteins. B12 and your folic acid are essential for cell growth, reproduction, and hematopoiesis. We'll be talking about this in a couple more chapters in more detail, but B12, folic acid, super important. Something that you see in people who are pregnant, in those prenatal vitamins that they take, you're going to have B12 and folic acid in those. And then vitamin C, ascorbic acid, you find it in citrus fruit, green veggies, tomatoes, potatoes, strawberries. Again, essential for collagen, catecholamines, and steroid production. Only indicated for scurvy. So if you're like, you should take vitamin C supplements for a cold. Well, there's not any solid research that vitamin C helps stop colds. But there is research that vitamin C helps stop scurvy. That's the only thing that it is indicated for. Alright, and we'll stop there and pick up with the mineral deficiencies in the next one.